Treatments start with non-operative treatments. The typical anti-inflammatory, Motrin, Advil, Aleve, take some Tylenol arthritis. Activity, precautions, be careful what you're doing. If you're overexerting the hip, maybe back off on some of the activities that directly affect your hip. The next order of business could consider hip injections, cortisone injections into the hip joint. That's a little harder injection to do. It's not something we really do right in the office. We typically need a fluoroscopy unit to be able to guide the needle down into the hip joint to make sure that we get it into the hip joint. But that's typically, it helps us with the diagnosis if there's some uncertainty whether that hip is really the cause of the pain. If you do a cortisone injection, the pain goes away at least temporarily for a couple of weeks to a couple of months. That helps conclude that it is hip arthritis. But invariably, typically the pain comes back after an injection. The final treatment is hip replacement, and it's an amazing surgery that more and more patients are choosing to have done every year. It's basically when we replace the socket with a metal and plastic socket. You prevent the bone from rubbing on bone by changing that bearing surface to metal and plastic or ceramic and plastic. It's very durable, lasts for many, many years. And most patients that are really limited with hip arthritis, they are so pleased after that hip replacement, they've got their life back. They can again enjoy life and stand and walk and do the fun things that they want to do.